Oh, Karen, good. I'm glad you have some downtime now. I wanted to check in about the bulletin board.
Yes, I saw it, but I was just gonna come find you because
Yeah.
I'm really worried about my patient right now.
Okay, what's going on?
So let me just pull out my papers. So you know that I was assigned to take care of Mr. Perry.
Yes.
So he's in room 412.
Yep.
And so this morning when I saw him and I helped him with his like morning routine and his like hygiene and breakfast, everything, he seemed fine.
Okay.
And he's here with heart failure. But then just now, a little while ago, when I went in the room, I noticed that he just seemed to be having a harder time breathing.
Okay.
And
Is he okay now?
well, I already got the floor nurse.
Okay, perfect. Okay.
And they already went in, but
Okay.
this is what I wanted to talk to you about because I right away noticed he looked like he was having a hard time breathing, and you know when we learned in class like the accessory muscles, I think
Yeah.
it's called.
Yep.
That's the first time I like saw it. Like he looked like he was
Okay.
having a hard time breathing, and I asked him if he was, and he said yes.
Okay.
And I checked his respiratory rate, and it was 28.
Okay.
And that's when I right away got the nurse.
Okay.
And they came in, and together we checked the pulse ox.
Okay.
And the SpO2 was normal. It was 96%.
Okay.
So the nurse said we didn't need to worry about it. But I still feel worried because I feel like it was different than he was this morning.
Okay. No, these are great assessments, that you picked up on. Did you listen to his lung sounds?
I did, but honestly, can you come? I think I might have heard crackles, but now
Okay.
I'm like not sure.
Sure.
Can
Well,
we just listen to them together?
Sure, absolutely. We'll go in together. But really what this is sounding like to me, we'll go in, we'll do a full assessment together. But, we were talking this morning about sort of those quality improvement indicators and some research. So one thing that we do know is that people with darkly pigmented skin, though the pulse oximetry can actually overestimate. And so I'm wondering what could be happening in this situation if he is reporting these signs and symptoms of shortness of breath. You're seeing those accessory muscles. This is a change. What about his heart rate? Did his heart rate tend to increase, or
So I think
we
it
can
did.
look at that?
Yeah, I think it did go
Okay.
up. So do you think he could be hypoxic even though his SpO2 was normal?
Was 90, you said 96%? Possibly. I mean, this is something that we should absolutely look into because, if all of those signs and symptoms are there, and most importantly, he's reporting that shortness of breath, then this could absolutely, be happening here. So what are some things? We'll listen to the lung sounds. I'm glad it sounds like the primary nurse is sort of taking care of things, which is the most important, is that he's safe. But what are some other things that you think we might be able to advocate for to the provider?
So the first thing is we want to listen to the lung sounds.
Yep.
And check the vital signs and ask him how he's feeling. So I think I tried to remember to do those things.
And we'll also want to take a look at his eyes and nose. We'll pull up
Okay.
Epic.
Right.
We'll look at his weight. We'll see if his weight has increased. I know he's also on a diuretic, right? He's on Lasix.
Yes.
So we'll want to sort of check that. Those are all some really important things. And can you think of any sort of lab work that the provider might order if those oxygen levels are saying 96%, but we're seeing these changes in him?
I don't know. Maybe it's like a hemoglobin.
Okay, so we could definitely get a CBC, but more importantly, we might want to think about getting an ABG because that would really give us an accurate, sort of a little bit better of a picture here of what's going on.
Okay.
So you did the right thing by coming to me. I'm glad that we've had this conversation.
I don't feel good about this situation, and I feel like maybe I should have pushed harder.
Yeah,
with the nurse
that's
or
okay.
something.
No, this is a learning experience for everyone. I think it's a great time to relook at that policy that we've been talking about and to really see that big picture about these inequalities that some of our patients will be challenged with.
Okay.
So, okay, let's go take a look at him, okay?
let's
All
go.
right,
Thank you
perfect.
so
Yeah,
much.
of course.